genuinely hope that you realize the power that you hold as a bedside nurse. Our patients have every right to refuse anything. Every right. But they need to be informed. Like this part of it is they have to be informed. And if someone is at high risk for blood clots, and just says, I don't want the heparin, and you say, all right, cool. Bye. Don't tell the physician. Physician has no idea that every shift, every 6 hours, it's getting refused, and the physician thinks that the patient's completely covered in terms of blood clot prevention, DVD prevention. Like, I'm sorry, that's poor quality of care. Like, and you can't tell me that you would, let's say you have a loved one in the hospital who's stubborn and says, and that happens to them. You can't tell me that you wouldn't be frustrated with that nurse who made no attempt to educate the patient to understand the implications of what they were refusing. I mean, you think about, I've had patients who've wanted to refuse stool softeners who had major surgery, who were, under for a long time, who weren't getting up out of bed. And they were already at risk for ileus. If I would have refused, would have not taken that moment to educate them, say, hey, I know you don't want to take this, but, getting a bowel obstruction is a major complication that we really want to avoid, and taking a moment to explain to them just basic about, hey, I'm going to make sure you get to the bathroom on time. I know that's your big worry, but because you don't want to go to the bathroom, we could be putting yourselves at incredibly high risk to have an ileus. And these complications can be death sentences for some people, or they can be profoundly change the trajectory of their recovery. And it's our responsibility, because we understand how effective these interventions are at preventing these serious complications. It's our job to let them know, all right, you can absolutely refuse this, but this is what that means. And this is why we're doing it. We're not doing it for fun, but this is why this medication or this intervention is ordered. I also wonder if you've ever been in that situation where you refuse something over and over again, and you've had a physician irate that the high-risk patient who should have been getting heparin through a PE post-operatively. Because I've seen that go down. That's not cool. And you got to explain to that provider why his patient or her patient is having a major complication that could have easily been prevented with 20 seconds of education. So, genuinely hope that you really realize the implication of this decision.